I am Sriharini from TNMSA. Today I will discuss about the perineum. Before going into the topic proper, let us have some questions. So I know all of you are aware of the homologous organs in males and females. Can you tell me what is the homologous organ of penis? In females, what is the corresponding organ of penis? Yeah, very good. It is clitoris. What is the homologous organ for scrotum? It is labium in females. What is the homologous organ for bulbourethral glands? Do anyone of you know? Yeah, Cowper's gland is other name for bulbourethral glands. In females, we'll be calling it as Bartholin's glands or the greater vestibular glands. Okay, fine. Now let us move on to the next question. So they'll be asking this question often. Okay, what is superior rectal artery is a branch from which of the arteries? They may ask. So do anyone of you know from where superior rectal artery arises? It is actually a continuation of superior mesenteric artery. Then middle rectal artery, it is a branch of anterior division of internal iliac artery. Then inferior rectal artery is actually a branch of internal pudendal artery, which in turn is a branch of inferior rectal artery. So I will show all of these arteries, so no need to worry, just to prepare you. So now let us move on to the topic proper, that is perineum. What is perineum? It is actually a diamond-shaped region which is located in the lowermost part of your abdominal trunk. Okay, what is the bone which is lying in front of you? It is the pelvic bone. So you know this pelvic bone has a pelvic inlet and a pelvic outlet. So this perineum is actually corresponding to the region of pelvic outlet. So whatever the structures which are contributing to the formation of pelvic outlet, whatever the structures which are present in the pelvic outlet will be constituting this perineum. Now this image is a cross section at the level of the pelvic bone. So you can see the perineum, which is located at the inferiormost part of your pelvic cavity. So you can see a black sheet of fascia which is separating the perineum from the pelvic cavity above. So what is this black sheet? It is your pelvic diaphragm. Just like your thoracoabdominal diaphragm, which is going to separate your thoracic cavity from your abdominal cavity, this pelvic diaphragm is going to separate the pelvic cavity above from the perineum below. Now this is to give you an orientation about where the location of perineum is actually. Now let us move on to the superficial boundaries of perineum. It is different in males and females. So in males, if you consider, anterior boundary will be the penis and scrotum. So this forms the anterior boundary, and posteriorly you have the natal cleft, and on either side you have the upper medial aspect of the thigh. In females, anteriorly you have the mons pubis and labia majora. Posteriorly you have the natal cleft, and on either side you have the upper medial aspect of the thigh. So this is regarding the superficial boundaries of perineum. Now let us move on to the deep boundaries. So you can just tell me from this diagram. So what are the deep boundaries of perineum? So it is a diamond-shaped region, I told you. So anterior boundary will be formed by the pubic symphysis, as well as you have an arcuate pubic ligament here. So these two will be forming your anterior boundaries. Now the posterior boundary, you have the tip of coccyx. This forms the posterior boundary. And on either side you have the ischial tuberosities. This forms the lateral boundary. And also you can tell me the anterolateral and posterolateral boundary. So anterolaterally it is between the ischial tuberosity and the pubic symphysis. So what is this structure? It is the ischiopubic rami. This forms the anterolateral boundary. And posterolaterally you can see a ligament which is extending from the sacrum to the ischial tuberosity. What is this ligament? It is the sacrotuberous ligament. Okay, so these are the deep boundaries of perineum. Are you all clear with the superficial and deep boundaries of the perineum? Any doubts? Do I want to repeat anything? Okay. So this diamond-shaped perineum can be divided into two triangles by an imaginary transverse. Okay, I'll repeat the superficial boundaries once again. So in males, superficial anterior boundary will be your penis and the scrotum, posteriorly will be your natal cleft, and on either sides you have the upper medial aspect of the thigh. In females, anteriorly you have the labia majora and mons pubis, and on either sides you have the upper medial aspect of the thigh, and posteriorly you have the natal cleft. Actually, this diagram is in lithotomy position, so from this you can tell the superficial boundaries of perineum. Am I clear? Okay, now let us move on to, so I told you this perineum is divided into two triangles by an imaginary transverse line. Okay, so this anteriorly placed triangle is called the urogenital triangle, and the posteriorly placed triangle is called the anal triangle. Now I will be speaking about each of these triangles in detail. So first let us see about the urogenital triangle. So this part is your urogenital triangle, I told you. So what are the contents, what will be present in this urogenital triangle? Just to give you a rough idea, in males you have the penis scrotum and you have the urethra in urogenital triangle, and in females you have the urethra and vagina in this urogenital triangle. Now let us move on to the layers of urogenital triangle. Okay, this is very important. It is made up of the 6 layers. Okay, you should be very much clear about all of these layers. Then you can answer any questions. Okay, so first layer is your skin. Second layer is your superficial fascia. Do you have a deep fascia in perineum? Do you think you have a deep fascia here? Yeah, you don't have a deep fascia. In the abdomen also, you don't have a deep fascia. This perineum is a continuation of it. So therefore, you don't have a deep fascia in perineum also. Instead, the superficial fascia will be divided into a fatty layer, superficial fatty layer, and a deep membranous layer. This deep membranous layer is given a special name, that is your Colles fascia. Then moving above, you have the superficial perineal space or the superficial perineal pouch. Then fourth layer is your perineal membrane. This is also called the inferior fascia of urogenital diaphragm. Then the fifth layer is your deep perineal pouch. And the sixth layer is your superior fascia of urogenital diaphragm. Okay, so I will tell you in this diagram. So the first layer is your skin. Then you have the superficial fascia that in turn has a fatty layer and a deep membranous layer, that is your Colles fascia. You don't have a deep fascia here. The third layer is your superficial perineal pouch. This the thing which I have represented the blue color will be your superficial perineal pouch. And the fourth layer is your perineal membrane, which separates the superficial perineal pouch from the deep perineal pouch or deep perineal space. Then the fourth layer is deep perineal space, and above that you have the superior fascia of urogenital diaphragm. Okay, so I have put in the slide that perineal membrane is also known as inferior fascia of urogenital diaphragm, and I have given separately that there is a superior fascia of urogenital diaphragm. So I indirectly implied that this deep perineal pouch is otherwise known as the urogenital diaphragm. Okay, according to the new concept, they are telling that there is no deep perineal pouch. Instead, this deep perineal pouch is equivalent to your urogenital diaphragm, which is in turn is bounded by the inferior fascia and superior fascia. Okay, so once again I am tracing superficially to deep. So the outermost layer is your skin. Then you have the superficial fascia that has a fatty layer and a membranous layer, that is your Colles fascia. Then you have the superficial perineal pouch. Then you have the perineal membrane. Then you have the deep perineal space or deep perineal pouch. And then above that you have the superior fascia of urogenital diaphragm. Okay, these are the various layers. Now I will tell about each of these layers. Okay, so skin. In males, the skin is actually your median scrotal raphe. And in females, the skin is your vestibule, that is the part in between the two labia majora that forms the skin layer. The second layer is your superficial fascia, that is, it is having a fatty layer. This is not much of significance. They will be asking about this Colles fascia repeatedly. So let us trace this Colles fascia. Actually, the Colles fascia posteriorly it is attached to the perineal membrane. Then it is continuing to the fascia of the scrotum, that is dartos muscle of the scrotum. It will be continuing with the dartos muscle. Then it will be continuing with the skin of the penis, and it will be continuing with the abdominal fascia, that is fascia scarpa of the abdomen. it will be continuing like this. So this will be the extent of the Cory's fascia. This they may be asking you in short answers, so you should know this diagram. So posteriorly it is attached to the perineal membrane, then it is continuing with the dartos muscle of the scrotum, then it will be continuing with the skin of the penis, and it will be continuing with the anterior abdominal wall fascia, that is fascia scarpa. Okay, so this is about the extent of Cory's fascia. Then about the third layer, let us talk about the superficial perineal space. So you can itself tell me the boundaries. So inferiorly you have the which layer, that is the Cory's fascia. Then superiorly you have the perineal membrane. I told you now. So superficial perineal pouch is in between the Cory's fascia, that is below you have the Cory's fascia and above you have the perineal membrane. And the special thing is that posteriorly this superficial perineal pouch or superficial perineal space will be closed. Anteriorly it will be communicating with the abdominal wall. Okay, so this has a special significance. I will tell you later. So this is about the boundaries of superficial perineal space. So below you have the Cory's fascia, above you have the perineal membrane, anteriorly it is communicating with the abdominal wall cavity. Now let us move on to the contents which are present in this superficial perineal space, which they have shown in blue color. Okay, so the contents can be remembered by a code number. I will give you 432. This will be the content. This will enumerate the contents. Okay, so it has 4 vessels, 3 muscles, and 2 nerves, and a specific content to male and female. Okay, what are the 4 vessels which is present? So I will not be insisting on veins here because they will be simply following the arteries. So I will be telling about the arteries. Okay, what are the 4 arteries present in the superficial perineal space? You have the deep artery of penis, dorsal artery of penis, artery to the bulb of penis, and posterior scrotal vessels. So what are these arteries? Let us trace them. Okay, you know the abdominal aorta is actually terminating as right common iliac and left common iliac. Okay, this common iliac in turn will be dividing into an external iliac and internal iliac. Okay, this internal iliac in turn is having an anterior division and a posterior division. Okay, in anterior division, after giving branch to the middle rectal artery, I told you in the first slide, no, the middle rectal artery is the branch of anterior division of internal iliac artery. So after giving this middle rectal artery, it will be continuing as the internal pudendal artery. This internal pudendal artery is the chief artery of perineum. So from this only, whatever the arteries I told, deep artery of penis, dorsal artery of penis, artery to the bulb of penis, and posterior, I told you posterior scrotal vessels or posterior labial vessels. Okay, that they are actually branches of perineal artery only. Okay, so these will be the vessels which is present in the superficial perineal space. Then I'll talk about the muscles. Okay, you have 3, so 4 vessels are over. Now coming to the 3 muscles. What are the 3 muscles? You have superficial transverse perineum. Okay, since it is in the superficial perineal pouch, it is transversely placed and it is a muscle of perineum. So it is named as superficial transverse perineum. Okay, what is the origin of the superficial transverse perineum? It is from your ischial tuberosities, inner aspect of the ischial tuberosities, and it will be inserted into the perineal body which is present here. Okay, so this is your first muscle. Then second muscle is your ischiocavernosus. So this arises from the inner aspect of your ischiopubic rami, and it is inserted into the crura of the penis. Okay, or crura of the clitoris in females, in case of females. Then the third muscle is your bulbospongiosus. So this will be embracing your penis in males. Okay, it is inserted actually into the bulb of the penis. And the bulbospongiosus in females will be embracing the vaginal orifice. Okay, these are the 3 muscles. So I talked about the 4 vessels and 3 muscles are over. Now coming to the 2 nerves, you have the posterior scrotal or labial nerve and muscular branch of perineal nerve. Actually these 2 are branches of perineal nerve itself, which in turn is the branch of pudendal nerve. I will talk about pudendal nerve later. Okay, just for now you remember that these are 2 branches of perineal nerve. And I told you specific content will also be there. So in case of males, you have spongy urethra here. Okay, you can see in the superficial perineal space, you have the spongy urethra, and you have the duct of bulbourethral gland, and you have the root of penis. Okay, so this will be the root of penis. So root of penis in turn has the bulb of penis and the crude of the penis. Both of them together we'll be calling it as root of the penis. So this is the content in males. Okay. So in males, spongy urethra, duct of vulvourethral gland, and you have root of penis. In females, you have urethra, vagina, and greater vestibular gland. I told you the counterpart for vulvourethral gland is greater vestibular gland or Bartholin's gland. So everywhere the counterparts will be coming into action. Okay. So these are about the contents of the superficial perineal space. Now going to the next layer. So above the superficial perineal space, you have the perineal membrane. Okay. So this perineal membrane, it is also known as inferior fascia of urogenital diaphragm. I told you. So this perineal membrane is a very tough triangular membrane. So you can see this will be your perineal membrane. Okay. So it is inserted into the perineal body. Okay. So it will be a triangular membrane. So it is very tense in males and it is somewhat lax in females. Okay. So this perineal membrane is going to separate your superficial perineal pouch below from the deep perineal pouch above. Okay. So this is regarding the perineal membrane. So you have various structures which perforate through the perineal membrane. Okay. What are the various structures? We'll see. That is, you have the dorsal arteries, dorsal nerve. Okay. The corresponding veins will be present. And you have urethra which is perforating the perineal membrane, and you have vagina in case of females, then arteries to the bulb of the vestibule, and you have the posterior scrotal or posterior labial vessels. So these are all the various structures. If you remember this diagram, you can tell out the various structures which are perforating the perineal membrane. Okay. So this is regarding the fourth layer. So I have talked to you about the skin, I have talked to you about the superficial fascia, then I show you about the superficial perineal pouch I talked to you. Then about this perineal membrane we have seen. Now let us move on to the space which is above, the fifth space, which is the deep perineal space. Okay. So what are the boundaries? Can you tell me the boundaries? So below what is the boundary? So from this you can tell me deep perineal space. So inferiorly you have the perineal membrane, and superiorly you have the superior fascia of urogenital diaphragm. This perineal membrane is otherwise known as inferior fascia of urogenital diaphragm, I told you. So the inferior boundary is your perineal membrane, superior boundary is your superior fascia of urogenital diaphragm. Okay. So these are regarding the boundaries of the deep perineal space. I have told you about the boundaries of deep perineal space. Now coming to the contents of the deep perineal space. Okay. For superficial perineal space, I told you the code number 432. 4 vessels, 3 muscles, 2 nerves. So here you have 3 vessels, 2 muscles and 1 nerve. Okay. Let us see the vessels. Okay, 3 vessels, the same vessels only, artery to the bulb of penis, deep artery of penis, dorsal artery of the penis, except the posterior scrotal or posterior labial artery you don't have here. Okay. I told you the posterior scrotal artery or posterior labial artery, it is a branch of perineal artery, so that will be at a superficial level only. So here only these 3 arteries you have. Okay, then what are the 2 muscles? So there I told you it is superficial transverse perineum. Here it is deep transverse perineum. Okay, since it is in the deep perineal space, we will be calling it as deep transverse perineum. So deep equivalent on a word is profundus. So they be simply calling it as transversus perineum profundus also. Okay. So this is one muscle, and the second muscle is your sphincter urethrae. So where is the sphincter urethrae? So it is around your membranous urethra. Okay. The sphincter urethrae is otherwise known as external urethral sphincter. Okay. So is this sphincter voluntary in nature or involuntary in nature? Do you know anything about it? Is external urethral sphincter voluntary sphincter or involuntary sphincter? Yeah, it is voluntary sphincter because it is supplied by pudendal nerve, which is a somatic nerve. So where is the internal urethral sphincter then? It is around the neck of the bladder. Okay. So quickly going through, I will tell you the 4 parts of urethra. You have the prostatic urethra, you have the membranous urethra, you have spongy urethra, and you have penile or bulbar urethra. These are the 4 parts of urethra. Okay, I told you spongy urethra was in the superficial perineal space. Okay, and this membranous urethra, it is about only 1.5 to 2 centimeter long. It is the narrowest portion of the urethra. Okay, this is in the deep perineal space. Okay, this membranous urethra is surrounded by your external urethral sphincter or sphincter urethrae. Okay, which is voluntary in nature. Then what is the action of this internal urethral sphincter? It is actually to prevent the retrograde ejaculation of semen and sperms. Okay, actually the seminal vesicle will be opening into this prostate. Okay, so it should follow in this way. Okay, in order to prevent the retrograde ejaculation, this internal urethral sphincter will be acting upon. Okay, so that is not important here. So here you have to concentrate about this external urethral sphincter, which is supplied by pudendal nerve, which is voluntary in nature. It is surrounding your membranous urethra. Okay, so this is about the sphincter urethrae we have seen, and you have only one nerve here, that is dorsal nerve of penis or clitoris you have. Okay. So then about the specific contents, in males you have the membranous urethra, bulbourethral or Cowper's glands, and in females you have urethra and vagina. Okay. Now I want you to get rid of this confusion. What is this urogenital diaphragm and pelvic diaphragm? So I have been telling about you this urogenital diaphragm, that in newer concept, instead of this deep perineal space, we have the urogenital diaphragm. Okay, which is bounded between the superior fascia of urogenital diaphragm, inferior fascia of urogenital diaphragm. That means it roughly corresponds to the deep perineal space only. So now they will be calling the deep perineal space as urogenital diaphragm. So this is something different. Okay, then what is this pelvic diaphragm? Did you remember that I showed in the first slide that this pelvic diaphragm was separating your pelvic cavity from the perineum. So that diaphragm is different and this diaphragm is different. So you should not confuse between these two diaphragms. Okay. And another point to tell that in females you don't have the splitting of urethra, prostatic membranous, spongy. So instead this external urethral sphincter will be having two parts. You have compressor urethrae and sphincter uretrovaginalis. Okay, so these two will be the divisions. So extra muscles in females. Okay, apart from external urethral sphincter, you will be also telling compressor urethrae muscle and sphincter uretrovaginalis in females. Now I will tell you about the urogenital diaphragm. So this is nothing but the deep perineal pouch or deep perineal space only. We are now calling it as urogenital diaphragm. So it includes all the muscles and fasciae of the deep perineal pouch equivalent to that of urogenital diaphragm. Okay, and whatever the structures which pierce urogenital diaphragm, which pierce the deep perineal pouch will be contributing to this formation of urogenital diaphragm. Okay, now you can, if you know all the structures which is present in this urogenital diaphragm, you can tell the actions also very easily. Okay, it is going to support your prostate and bladder. Okay, how? You can see the deep transverse perineum, it will be supporting your prostate, and the bladder will be supported by this urogenital diaphragm. So I have told you the deep perineal pouch is equivalent to the urogenital diaphragm. No? So it will be supporting your prostate, it is supporting your bladder, it is fixing the perineal body. The deep transverse perineum will be inserted into the perineal body, so thereby strengthening the perineal body. It is going to constrict the vagina, the sphincter uretrovaginal sphincter or sphincter uretrovaginalis will be helping in contraction of vagina also. And voluntary control of micturition can also be done because you have the external urethral sphincter here. So these are the actions of urogenital diaphragm. So this they may be asking as a separate short answer question. So you can tell you the actions of urogenital diaphragm easily if you know what are the structures present there. Now coming to the applied aspects of this urogenital triangle. Okay, so I told you two urethra are present in this urogenital triangle. Okay, the spongy urethra was present on superficial perineal pouch. I have showed you previously. Okay, so suppose if there is a rupture of this spongy urethra by any instrumental procedure or any trauma which has happened. So if there is any rupture of urethra, the urine will be extravasating into which of these layers urine will be extravasating, they will be asking. Okay. So see here, this is the rupture of spongy urethra. So the urine will be filling the entire superficial perineal pouch. Okay, and I told you the superficial perineal pouch was opening anteriorly. It was continuing. So it will also it is also continuous posteriorly. Okay, so it will be filling the entire scrotal sac. It will be filling your penis, and it is also continuous to the anterior abdominal wall. So the urine will be extravasating into all these layers. Okay. But urine will not extravasate into deep perineal pouch. Why it will not go to deep perineal pouch? Because you have the strong, tough perineal membrane which is separating the superficial perineal pouch and deep perineal pouch. So it will not go into deep perineal pouch. Okay. Urine will not extravasate into thigh also. Why? Because you have a strong fascia lata which is actually attached to the Holden's line. Okay, so this will be preventing extravasation of urine into the thigh, and it will not go to the ischiorectal fossa which is located posteriorly, because I told you Colles fascia, it was attached posteriorly, it was attached to the perineal membrane or limit irukkudu. So it will not go into the ischiorectal fossa also. Okay, so this they may be asking as an applied question. Okay, where are all it extravasates, to which areas it won't extravasate. Okay. Then in case of rupture of membranous urethra, where the urine goes, if membranous urethra is ruptured, I told it is the narrowest part of the urethra, no? So it is easy to, it will be very much liable for any rupture. Okay, so the urine will be extravasating into the entire deep perineal pouch. It will be going to the space of red CS or the retropubic space, and it will also be filling posteriorly. Okay, because it is not limited by the perineal membrane, so ischiorectal fossa also it will be extravasating. Okay, it will not extravasate into the peritoneal cavity. Okay, you have the so it will not go, because the strong peritoneal membrane, because of the peritoneal membrane, it will not go to the peritoneal cavity. Instead, it fills the deep perineal pouch. It goes to the retropubic space of red CS and posteriorly to the ischiorectal fossa also. Okay, this is an applied aspect regarding this urogenital triangle. So that's all about this first part, first anterior triangle, urogenital triangle I have completed. Any doubts in this level? Anything to be repeated again? I'll summarize to you. The layers you should be very much clear of. So first layer is your skin. Okay, I told you in males and females what is the structure. Then you have the superficial fascia in that fatty layer and a membranous layer, that is the Colles fascia you have. Then you have the superficial perineal pouch. So this is your superficial perineal pouch. Then you have the perineal membrane, strong perineal membrane which is separating. So this perineal membrane is otherwise known as inferior fascia of urogenital diaphragm. Okay, it's also known as inferior fascia of urogenital diaphragm. Then you have the deep perineal pouch. Okay, so this deep perineal pouch, by newer concept we are calling it as urogenital diaphragm. Okay, then you have the superior fascia of urogenital diaphragm. Okay, so these are the 6 layers you should be clear of. Okay, Colles fascia you also have in females. Okay, but the extension will not be into the scrotum, and you don't have, no, so it will be extending into the anterior abdominal wall. Okay. Now coming to the anal triangle, which is the posteriorly placed triangle. Okay, so this will be the anal triangle. Okay, so you can tell me the boundaries. Anteriorly you have the transverse, imaginary transverse line which is drawn in between the 2 ischial tuberosities. Okay, or the posterior border of the perineal membrane, or a posterior border will be forming the anterior boundary of anal triangle. Posteriorly you have the sacrotuberous ligament, and the sacrum and coccyx will be the posterior boundary. So this triangle is your anal triangle. We are going to see about it in detail. Okay, so you have 3 parts under this. You have the anal sphincter and anal canal. Okay, then you have the ischiorectal fossae. This is the ischiorectal fossae, and you have a perineal body. Okay, which is a fibromuscular node which is just separating your urogenital triangle and anal triangle. Okay, so about these 3 things we are going to see. So first about your anal sphincters. This they'll be telling in detail about in anal canal also, just to have a guess. Okay, external anal sphincter, and you have 2 anal sphincters, no? External anal sphincter and internal anal sphincter. Okay, external anal sphincter in turn will be having 3 parts. You have a subcutaneous part, you have a superficial part, and you have a deep part. Okay, and internal anal sphincter will be lining your anal canal. Okay, it is actually longitudinal, so this is not that much important. Okay, external anal sphincter will be contributing to this, will be present in this anal triangle. Okay, then about the anococcygeal ligament, it is actually derived from the external anal sphincter and the levator ani muscle. Okay, so from this this anococcygeal ligament is derived. Okay, it is extending from the tip of coccyx to the anus. Okay, the function of this is to support your rectum. So this is regarding the first part. Then the second part I am going to tell is about the ischiorectal fossa or ischioanal fossa. Okay, so it is actually a wedge-shaped fossa which is fully filled with fat. Okay, why it has so much fat? Because to support the distension of rectum. during defecation to support the distension of the organs, support the distension of the rectum. You have fully fat-filled cavity. So this is your ischioanal fossa. Then coming to the dimensions of ischioanal fossa, you can easily remember as 5 cross 5 cross 5 centimeter. In some books they'll be telling that the width is 2.5 centimeter. Some books you also have 5 centimeter. Okay, so 5 centimeter anteroposteriorly, 2.5 to 5 centimeter in width, and 5 centimeter vertically, or the depth is 5 centimeter. Okay, so this is the dimensions. Now coming to the boundaries. Okay, you can tell me the anterior and posterior boundaries. The same only. Anteriorly you have the imaginary transverse line which is drawn in between the two ischial tuberosities. Posteriorly you have the same sacrotuberous ligament in the coccyx. Okay, in order to understand the medial and lateral boundaries, you should take this is a coronal section. Okay, you can the green color thing is your ischiorectal fossa. So the lateral boundary, let us see the lateral boundary. So you have, this is the lateral pelvic wall. Okay, you all know in pelvic wall you have a foramen. What is that foramen which is present in the pelvic wall? It is your, you have a circular foramen in pelvic wall, no? So what is the foramen which is present in that pelvic bone? It is your obturator foramen. Okay, so the muscle which is covering the obturator foramen will be the obturator internus. Very good. It is obturator foramen, and which is the muscle. It will be lined by this. It will be fully covered with this obturator internus muscle. So you can easily remember that the lateral boundary is your obturator internus with the obturator fascia. Okay, and you can see a special canal which is present in this facial tunnel. Okay, you can see which is present near the obturator internus. So this canal is your Alcock's canal or Pudental canal. Okay, so this will be forming the lateral boundary. Then medially you can see these structures. Okay, you have the external anal sphincters medially, and what is this muscle? It is levator ani. Okay, so it is actually elevating your it appears to elevate your anal canal, no? So this is named as levator ani muscle. Okay, so this will be forming your lateral boundary. So I told you about the anterior and posterior boundary. I told you about the medial and lateral boundaries I have told. Now coming to the, it has an apex and it has a base. Okay, the apex is formed by the union of the fascia over the levator ani and the fascia over the obturator internus. So this will be forming your apex, and the base is actually formed by the skin and the superficial fascia you have. Okay, so these are the boundaries. So I have told you anterior posterior boundaries, laterally I have told you, medially, and apex I told you, and base. Okay, the two things to remember in this ischioanal fossa are it has 3 recesses and 3 space. Okay, let us see about each of these things. Okay, so the recesses, actually you have 3 recesses. Okay, what are they? Anterior recess, posterior recess, and a horseshoe shaped recess. Okay, this anterior recess is actually extending above the urogenital diaphragm. You cannot visualize it. Okay, somewhere above the urogenital diaphragm, there is a space, that is your anterior recess. Posterior recess will be by the sides of the sacrotuberous ligament. You have the posterior recess. Okay, and you have a special recess. This is called the horseshoe shaped recess. Okay, so this is actually connecting ischiorectal fossa of one side with the ischiorectal fossa of other side through posteriorly. So this is somewhat horseshoe shaped. So this is called the horseshoe shaped recess. Okay, this has got significance because any infection which is present in any one side of the ischiorectal fossa can easily communicate with the other side also. So if there is an infection of this side, it will definitely go to the other side also through this horseshoe shaped recess. Okay, these are the 3 recesses which are present in the ischiorectal fossa. It also has 3 spaces. Now let us see about the spaces. Okay, so before that you have to understand this diagram. I told you this is your levator ani muscle, this is your obturator internus muscle. Okay, you can see the fascia covering them. Okay, so from these 2 fascia only you will be getting a blue colored fascia, okay, which is semicircular in shape. Therefore it is named as lunate fascia. Okay, so this lunate fascia is the main thing which is going to separate this ischioanal fossa into 2 spaces. That is suprategmental space. Whatever the space which you have above this lunate fascia we'll be calling it as suprategmental space, and whatever the thing which is below that lunate fascia we'll be calling it as the ischioanal space proper. Okay, and also you have another fascia called perineal fascia. This perineal fascia is extending from the white line of Hilton in the anal canal okay, up to the pudendal canal or Alcock's canal, up to that it is extending. So this is your perianal fascia. Okay, so this separates this into ischioanal. Above that you have the ischioanal space proper, and below that you have the perianal space. Okay, so you have got three recesses. I told anterior recess, posterior recess, horseshoe-shaped recess, and three spaces are suprategmental space, tegmental or ischioanal space proper, and you have the perianal space. These are the three spaces present. Okay, so I have told you all the things about it. Now let us talk about this pudendal canal or Alcock's canal. Okay, so this pudendal canal, it is a facial tunnel which is extending from the lesser sciatic foramen. Okay, it is extending from the lesser sciatic foramen up to the deep perineal pouch. Okay, so this is your pudendal canal. Okay, this is in the lateral pelvic wall. Okay, this landmark, it is about 2.5 to 3 centimeter above the ischial tuberosity. Okay, it is formed from three fascia. What three fascias? You can see the blue color fascia. Lunate fascia will also contribute to this pudendal canal. The fascia covering the obturator internus will also contribute to your pudendal canal, and the perianal fascia will also contribute to the pudendal canal. So this pudendal canal is derived from three fascias. It has three contents. Okay, what are the three contents? You have internal pudendal artery, internal pudendal vein, and pudendal nerve along with the divisions. Okay, I have told you about the internal pudendal artery in before slide itself. Okay, now let us see about this pudendal nerve. Okay, so this pudendal nerve is actually formed from the ventral rami, the union of ventral rami of S2, S3, S4. These will be uniting. Actually, it is formed in the pelvis. Okay, it is formed in the pelvis by the union of these S2, S3, S4. It goes behind the pelvis through the greater sciatic foramen. Okay, it exits out of the pelvis and goes posteriorly. Okay, and it will be resting behind the ischial spine. Okay, so you have a greater sciatic foramen here. You have the ischial spine and lesser sciatic foramen. No, so it will be exiting the pelvic cavity through the greater sciatic foramen. It will be resting on the ischial spine, and it is entering through the lesser sciatic foramen. Okay, into the pudendal canal. The dotted line represents the pudendal canal. Okay, it will be entering into the pudendal canal, and in the pudendal canal, after giving inferior rectal nerve, it will be dividing into two branches. Okay, you have the dorsal nerve of penis, and you have the perineal. And you have the perineal nerve. Okay, so these two branches are given off in the pudendal canal. So which two branches are given off in the pudendal canal? They may ask. Okay, dorsal nerve of penis and perineal nerve. Okay. This perineal nerve in turn will be dividing into a posterior scrotal nerve and a muscular branch of the perineal nerve. Okay, later on. In the pudendal canal, you should remember this division. Okay, division of after giving a inferior rectal nerve, it is dividing into the dorsal nerve of penis and the perineal nerve. Okay. Now, an applied aspect regarding this pudendal nerve, it is very important during the delivery. Okay, so sometimes if there is a difficulty in descent of the child, they may go for forceps delivery. Okay, so during that they have to apply a local anesthetic agent. Okay, so for this they will be searching for this pudendal nerve. Okay, so what is the landmark for this pudendal nerve? Is your ischial spine. So perivaginally they will be palpating the ischial spine, and near to that only it will be entering the pudendal canal. I told you, no, it is resting on the ischial spine and it enters into the pudendal canal. So at this site they will be infiltrating the local anesthetic in order to get the block. Okay, so this is called the pudendal nerve block. Okay, this is very important. Okay, so ischial spine, what is the relation of the ischial spine? Kepanga, pudendal nerve is always related to this ischial spine. Okay, landmark for this searching this pudendal nerve is your ischial spine. Okay. Now coming to the contents of the ischiorectal fossa, I have told you about the ischial pad of fat. Then inferior rectal nerve and vessels I told you. So inferior rectal nerve was a branch of pudendal nerve, and inferior rectal artery, it was a branch of anterior division of internal iliac artery. It is a branch of internal pudendal artery. Okay, which in turn is a branch of anterior division of internal iliac artery. Then you have the pudendal canal along with its contents. Then you have the posterior scrotal or labial vessels, and also you have the perforating cutaneous branches. These are the contents of ischiorectal fossa. Okay, you can see the various contents: posterior scrotal nerve and vessels, inferior rectal nerve and vessels, ischioanal pad of fat. Okay, this is very important. Now coming to the some applied aspects in this overall ischiorectal fossa la enna applied aspects irukku. Pudendal canal patti I told an applied aspect, pudendal nerve block. Okay, ipo gross ah nama ischiorectal fossa pathona, this area is very much prone for infections. Okay, so infections can come either from the skin. Okay, skin la irundhu direct perineal skin la irundhu direct infections varalam, or from the anal canal infections can spread, or from the pelvic cavity infection can spread. Actually sometimes you have an hiatus here, that is called as hiatus of Schwalbe. Okay, so from this hiatus any infection in the pelvic cavity can migrate and it can come down and present as ischiorectal abscess. Okay, this ischiorectal abscess, another applied I told you, if any side, if there is an ischiorectal abscess of one side, it is definitely going to spread to the other side through the horseshoe shaped recess. Okay, and also you have perianal abscess. Okay, in this perianal region you have perianal abscess. This is very much painful because the fat will be highly localized here. Okay, so ischiorectal abscess is very, very common in this area. Okay, it is very common in immunocompromised people. Okay, and sometimes this ischiorectal abscess may burst, or if you are if there is any injury to this ischiorectal abscess, it may open into either the anal canal or it may open into the skin. Okay, so if it is opening into the anal canal, we'll be calling it as anorectal fistula. Okay, if it is opening into the skin, we'll be calling it as fistula in ano. Okay, so any of these things can develop from the ischiorectal abscess. Okay, so if you are concluding anything, just write some applied aspects. Okay, this will give you a better impression. Okay, and you can also use it in surgery and OG. This part is very, very important. Okay, now I'll talk about the third thing, that is the perineal body. Okay, what is this perineal body? It is actually a fibromuscular node which is located in the median plane. Okay, so this is actually your perineal body. So it is present 1.25 centimeter in front of the anal margin, or it is present posterior to the bulb of penis, or posterior to the posterior vaginal wall. Okay, at its apex, rectovaginal septum will be attached. Okay, this perineal body is very, very important thing, that it gives supports to all the pelvic organs. Okay, in females this is very, very important. Okay, if you are contracting, if there is contraction of perineal body, now it will be supporting all your pelvic organs. Okay, so support kudukuduna, some muscles should be attached. Okay, various muscles are attached to this perineal body. Okay, totally you have 10 muscles attached to the perineal body. So in order to remember that, I have a mnemonic. Okay, you can remember, we are blessed to have the perineal body. Okay, females are blessed to have the perineal body. So instead except the letter E, all other things will be forming this muscle. Okay, what are the various muscles? You have bulbocavernosus or bulbospongiosus, both are same. Okay, on either side. Okay, so this will be 2 in number. So then you have levator ana muscle also will be attached to this perineal body. This will be in 2 in number, so totally 4. Then you have the external anal sphincter which is attached, and 2 superficial transverse perineae, 2 deep transverse perineae also, and you have sphincter uretrovaginalis in females. Okay, sometimes the longitudinal muscle of the anal canal can also contribute to this perineal body. So totally 10 muscles you have in perineal body. Okay, so these are the various muscles attached to the perineal body. This is an important question, they may ask you repeatedly. Okay, so remember this mnemonic also, you will never forget. Okay, so remember that you have another muscle called ischiocavernosus. This will be never a part of perineal body. Okay, they may ask you in MCQs. Okay, so this ischiocavernosus is a separate muscle. It is originating from the ischiopubic rami and it is attached to the crest of the penis or crest of the clitoris, I told. Okay, so it is never a part of perineal body. So all other muscles will be contributing to the formation of the perineal body. Now an applied aspect regarding this perineal body is your episiotomy. What is this episiotomy? It is actually an incision which is given, okay, during difficult childbirth, okay, in order to allow for the dilatation of the vagina. Okay, they'll be giving an incision, that is episiotomy. Okay, previously they were giving a median episiotomy. Okay, so right in the perineal body they were giving you an incision. Okay, but this has the danger that it may injure your external anal sphincter also. Okay, if external anal sphincter is injured, there will be anal fecal incontinence. Okay, So that is a very, very dreaded complication. So nowadays we are going for mediolateral episiotomy. Okay, we are just cutting your bulbospongiosus muscle, the labia minora. So this will be only cut, okay, in order to facilitate the dilatation of the vagina. Okay, so episiotomy is given in order to prevent irregular perineal tears. Okay, if you give a labored episiotomy, then the healing will also be good and there will be no further injuries. Okay. So that's all. Any doubt up to this level? If I was speeding any part, do you want anything to be repeated? Okay. Now I'll proceed. Okay. About this pelvic diaphragm. Okay. What I told about the pelvic diaphragm in the first slide itself, I told you that the pelvic diaphragm is going to separate the pelvic cavity above from the perineum below. Okay, so a few words I want to add about this pelvic diaphragm also. Okay, so this pelvic diaphragm is separating the pelvic cavity from your perineum. Okay, so this pelvic diaphragm is a muscular diaphragm. It is a strong muscle. Okay, this only is going to hold all your pelvic organs in position. No, so what are the muscles contributing to this pelvic diaphragm? It is your levator ani muscle and ischiococcygeus muscle. Okay, so you can see levator ani muscle. Okay, so actually levator ani la you have only two parts. Okay, pubococcygeus and iliococcygeus. Okay, this ischiococcygeus is a separate muscle. So coccygeus mudinjalume, it is actually a separate muscle. It is not a part of levator ani. Okay, on the levator ani la only two parts you have, iliococcygeus and pubococcygeus. Okay, pubococcygeus in turn has puborectalis and sphincter vaginae in females and levator prostatae in males. Okay, this ischiococcygeus ki innor name na coccygeus nu solluvom. Okay, this is actually a separate muscle. Okay, so let us see about the levator ani origin. Okay, so levator ani ku moonu origin irukudhu. Okay, it is from the pelvic surface of the ischial spine and start agudhu, tendinous arch of the obturator fascia, and you have the pelvic surface of the body of the pubis. Okay, so in the moon la irundhu levator ani originate agudhu. Okay, it is actually inserted into the perineal body nama paathomla. So it is inserted in the perineal body. What is the direction of levator ani muscle fibers nu kepanga? It is downwards, backwards and medially. Okay, appadi nama and the fetus oda descent facilitate pandradhukaga dhaan vandu it will be structured in such a way. Okay, in the levator ani I told you it has two parts, no, pubococcygeus and iliococcygeus. Okay, and the pubococcygeus la puborectalis irukudhu. The puborectalis will be forming a sling around your rectum. Okay, so this is the anorectal angle maintain pandradhukku. Okay, so anorectal angle for holding your feces. Okay, at appropriate environment and suitable time only you are defecating. No, so in order to prevent that over distension, you have an anorectal angle that will be maintained by the puborectalis. Okay, and you have sphincter vaginae or levator prostate in males. Okay, so this is your pubococcygeus part, and the second part is your iliococcygeus. Okay, it is actually forming the anococcygeal raphe. It is inserted into the anococcygeal raphe here. Then the second part of your pelvic diaphragm is your ischiococcygeus. Okay, so this ischiococcygeus is originating from the apex of the ischial spine and the sacrospinous ligament start inserted into the last pieces of the sacrum and the upper two pieces of the coccyx. It is inserted. Okay, so this is about the pelvic diaphragm. Now an applied aspect of this pelvic diaphragm, I told you this pelvic diaphragm only it is going to support all your pelvic organs. Okay, so pelvic cavity level all organs it is supported by your pelvic diaphragm. So just like you hold a ball on your intertwined with the fingers intertwined, okay, eppadi nama support pandromo adhe madiri support pannirkom. In case if there is any injury to the perineal body, okay, if it is distended in parturition, okay, or if there is any tear to the perineal body abdina, there will be prolapse of all the genital organs as well as the prolapse of bladder, prolapse of rectum vandrum. Okay, so that only so after parturition they will be advocating Kegel's exercises. Okay, so in females they will be advocating that. So in order to strengthen this pelvic diaphragm and perineal body strengthen pandradhukku they will be advising that. Okay, so if there is weakness of perineal pelvic diaphragm it leads to prolapse of all the genital organs as well as the rectum and anal and bladder. Okay, that you have to remember regarding this pelvic diaphragm. So I have finished my topic. Now let us have some, these are the previously asked university questions. Okay, if you want, you can take it down. Perineal body is an important question. Ischiorectal fossa also. These are short note questions. They may ask separately, and these are the short answer questions. Okay, now let's have some MCQs. Which of the following muscles is not involved in the formation of perineal body? I told you the perineal body and the 10 muscles inserted. Okay, so among that, which of these muscles or which one of the muscle is not a part? Bulbospongiosus, superficial transverse perineum, internal anal sphincter, deep transverse perineum. Which is not a part? Yes, it is internal anal sphincter. Very good. Only the external anal sphincter will be forming a part of your perineal body. Okay, you can remember that blessed. Okay, mnemonic. Then a line between which of these structures divide the perineum into two triangles? I told you that perineum was divided into two triangles by an imaginary transverse line. Which was the line passing through? Yes, very good. It is ischial tuberosities. So sometimes they may confuse you with the ischial spines. So don't be confused. Okay, the bony prominence is ischial tuberosity. Then ischial spine was related to which of the following nerves? Yes, it is the pudendal nerve. Okay, this is a very, very important landmark in OG. So to search the pudendal nerve block, they will be locating the ischial spine first and then infiltrating. Which of the following forms the anterolateral wall of true pelvis? I told you in the pelvis you have a foramen muscle which is a muscle which is covering that foramen was? Yes, very good. It is the obturator internus muscle. So this forms the anterolateral wall of your true pelvis. Which is not a part of levator ani? I told you in the last diagram. So you have two parts and yes, it is ischiococcygis. Okay, ischiococcygis though sounds similar, it is actually a separate muscle. Okay. Only the iliococcygis and pubococcygis will be the part. Okay, levator prostatae is actually a part of pubococcygis only. You have under this pubococcygis, you have puborectalis and levator prostatae. Okay, so that's all. Any doubts? Do you have anything to be repeated?